like we have a chance here.
Too many people abuse antibiotics. Too many. Let's start from the beginning.
Welcome to this chat session. Us here is from Abuja, Abdulaziz, a pharmacist who recently finished her internship at the Hospital Management Board here in Abuja. She's passionate about healthcare education, about bridging the gap between the system and the people, especially on topics pertaining to antimicrobial resistance, postpartum depression, and health insurance literacy. She's here today to tell us a lot about the hospital system, the way forward, the solutions, what can we do to help ourselves as individuals. First of all, what sparked your interest in bridging the gap between the healthcare system and the people?
I've always believed that information is power. I have noticed that people who do not have access to information lose out on so many things.
When you think of healthcare in Nigeria, what comes to mind first?
The first word that comes to mind is fragile. I think that the healthcare system in Nigeria is very shaky and that it's on its last leg. And even if it is not on its last leg, it's on its way there. I was going to say it's in shambles, but that would be very unfair to the men and women who carry the system on their backs day in, day out. Joheso has been on strike for the past over 40 days now. Even when they were not on strike, the workers were doing what they could with the little they had. Now imagine when a large chunk of the healthcare team is not in the hospital. It was already not working as well, but now it's going to be even much more fragile.
Are there moments at work, are there encounters you have had in the hospitals that made you feel hopeful, that made you feel like we have a chance here?
Two stand out. The first happened when I was on ward round with the healthcare team, and this consultant squealed and clapped her hands like a baby when she found out that a patient that she was managing had been discharged. It was one of my first ward rounds, and today it still strikes a chord in me whenever I remember it. I feel very warm inside whenever I remember it, because to take care of someone to such an extent, she has given this patient, I do not know the condition the patient was brought in for, but she had given her her best, and it made her so happy that her patient had felt better to the extent that the patient could leave. And the second happened in front of the A&E ward. The patient was being wheeled into the A&E ward, and the man ran ahead to open the door to the ward without being asked. And I know some people say, oh, that's just humanity. But I even wrote it down in my notes in my phone, because of how it just warmed my heart. It made me feel, okay, there's hope for the world yet. I don't know whether I already lost hope in humanity, but
what false ideas do we have that we need to unlearn? What myths and what tales have we been told?
First one is the antibiotics cure all infections. Antibiotics do not cure all infections. They only work for bacterial infections. Viral infections are very self-limiting. You should only manage yourself at home for 3 days, after which you should go to see a doctor. If you're having a sore throat, you can just do salt and warm water, salt and warm water gargle, or you drink ginger tea or steam at home. First day, second day, it's still persistent, go to the hospital. If you feel well, you don't need to see a doctor. You don't need to go to the hospital. And I say false to that. My supervisor in university, my project supervisor in university, Dr. Iyabo Adebisi, used to say something. Shout out to that woman. Phenomenal woman. She used to say, all science is good science. And I'm carrying that through life. If you carried out an experiment and you did not get like the positive answer you're looking for, it's still an answer. And it is still maybe not what you're looking for, but at least you now know that it does not do what you wanted it to do. And so now you try something else. All results are good results. So go to the hospital whether you're feeling well or not. Go check up. Let them run their tests. I know it feels somehow as a Nigerian to go and spend your money on something that did not have to spend it on. But this is your health we're talking about. Just go for proper diagnosis, management, and your body will thank you. health insurance is for government workers. I did not realize like how many people truly believe that until I started talking to patients about it. And it occurred to me that many people actually pay out of pocket because they don't know that they can enroll for health insurance. As a business owner, you can enroll for up to 10 of your workers. You can do like, I think they call it gift ship. Under gift ship, you can enroll for 10 of your workers for health insurance under the National Health Insurance Authority. For FHIS has like one package for everybody. I think you pay 22,500 per year, and it covers a free delivery, free healthcare after delivery, post delivery, including CS. And people don't have like, and that's why I said access to information is very key.
What health habits should we embrace to stay on top of our game in 2026?
Take a balanced nutrition. Try to incorporate balanced nutrition into your diet. You can add fruits, vegetables. Maybe you're just cooking your rice. Cut carrot and green beans, even if it's white rice. You are eating yam. You can eat it with garden egg stew or vegetable sauce. Ensure to stay hydrated. Drink enough water daily. Limit processed foods. Even I am supposed to take this advice for myself. Ensure that you regularly exercise. Do regular exercise, regular movement. At least 30 minutes a day. I do not emphasize this enough. Please go outside. Go outside. And I don't just mean to walk. Look at the sky, watch the birds fly, smell the flowers. I know they don't always smell nice, but find beauty in the mundane. It has immense mental benefits. You can just do it in your neighborhood, in your house. You have just put a mat under a tree. You have games, Ludo, your Words, your Scrabble. Play with your family, laugh. There's something that I've been saying very recently. People want a village, but they don't want to be villagers. And me, I've always been a villager, Sha, but I just want to share with people. Try to be a villager. Try to help people. 7 to 9 hours a day of sleep really helps. And I know before there used to be research that said men and women like we could have the same amount of sleep, but now research is showing that women need more hours than men. And this also ties in, and that's what I want to say. Reduce your screen time. Reduce your screen time. If you can reduce your screen time, it will really help. For people who smoke and drink, if you don't already smoke and drink, avoid it. But if you do, I would not just advise you to reduce. I would advise you to stop altogether. But if you cannot stop at this time, reduce it. Don't smoke. Don't drink. It has extensive negative effect on your body in the long run, and we do not want that.
We want to start this culture on our channel where we leave our guests with one random question. If you could change one thing in the world, what would that be? If you had the power and the resources to make one impact, what would that be?
It would just have to do with people's attitude towards postpartum depression. I have seen firsthand what it does to a woman. For someone who has never had a child, it can actually be a triggering reason when you say you never want to have a child. But I have also seen that it doesn't happen to everybody. Once during one of my postings, I was on a weekend shift. And I came to the hospital, I think it was on a Sunday morning. And the woman had dropped her baby and told the nurses that they should call her not to come and carry the child and take the child to his mother. What happened? She gave birth to that child, and the child was diagnosed with jaundice, and they had been in the hospital for I think over a week. And everybody was, you know how Nigerians can be, very judgmental. And I was like, nobody even talked about this woman's mental health. Days ago, I was at Federal Medical Center Abuja, and I saw that their behavioral and mental unit is close to the postnatal ward. It really made me happy. I'm not sure if that was by design or maybe that was just the only room they had, but it made me really happy because it meant if a new mother has a mental issue or a mental break or something, help could quickly get to her. I've seen somebody whose postpartum depression led to a schizoaffective disorder. And somebody will come on the internet and say, oh, it's not real. People need to be more educated about postpartum depression. So yes, I would love to change the culture around how people perceive it. To also create a system where people who go through it get better care so that people can talk about it without any fear of stigma.
It's been a very empowering discussion with you. We've learned a lot. Personally, I think I've learned one or two things, especially regarding the insurance matter and how postpartum depression can be a schizoaffective disorder. Okay, it's been a very great time with you, Khadija. Thank you for gracing us with your presence and your
For having
professional
me.
words of advice. We're so pleased to have you. Please don't forget to hit the subscribe button, like and comment so that as we are growing, we'll be able to attract more personalities like Khadija and even bigger personalities in times to come.
Thank you for
Khadija, any
having me.
word for your viewers?
I just want to leave people with a few words. Antimicrobial resistance is real. Avoid taking antibiotics indiscriminately. See your doctor for regular checkups, whether you're feeling well or not. At least twice in a year, it's not too bad. Stay hydrated. Hydration really does a lot for people. And go outside. Smell outside. Touch grass. Touch grass. Touch grass.